Our group is going to be discussing transgender people of color and the discrimination they face. So first, I want to start by talking about the history of the transgender community. It was actually pretty hard to find history prior to the 1900s. Transgender people always existed, but they weren't medicalized until the 1800s by German and English sexologists. It was seen medically as a disease needing treatment, and religious people believed they needed an exorcism. Many of the theories in the 1800s on why people were transgender also came from Freudian psychoanalysis. He saw men as needing to be masculine and women as needing to be feminine, and anyone who didn't conform was likely to be transgender. It wasn't until 1949 that the term transsexual was formed and first used in medical literature. Going into the 60s and 70s, that's when activism really picked up and the transgender community started to be talked about more. A big reason for this is mainly relating to the Stonewall Uprising. This was in 1969, where police raided a gay club in New York City and roughly threw out workers and customers from the bar. This led to protests and riots and jump-started the gay rights movement in the United States and across the world. Marsha P. Johnson and Sylvia Rivera are good examples of activists during this time. They were close friends and drag queens at the club that was raided, so the issue was really important to them. When looking at modern day issues, there has been some improvement in terms of activism and raising awareness. However, there is still a lot of discrimination faced. The transgender community currently faces high rates of violence and specifically murder. There is still a struggle with mental health, and there is discrimination in the healthcare system.
Defining the problem. Discrimination and violence towards transgender women of color. Transgender women of color face discrimination in her home and by the government. Many trans women are disowned by their families. The three branches of government in the U.S. discriminate against trans women of color in various ways. Intersectionality. Transgender women of color have many intersecting identities. These identities include the fact that they are people of color, the fact that they are women, and the fact that they are transgender. These intersecting identities causes many problems for transgender women of color. Low life expectancy. Discrimination against trans women of color, their intersecting identities, the lack of protection, and little access to health care all play a major role in the low life expectancies of transgender women of color. Less access to health care. Transgender women of color have little access to health care, which can cause many problems. Healthcare is an important factor, and it could allow trans women to get operations, testings, and more. Last but not least, they are the least protected in classes of individuals. Transgender women of color have less access to many things essential to their livelihood. Transgender women of color are protected by police force and have a high murder rate and low life expectancy.
Next, we have the physical violence against trans women of color. There were 53 known transgender victims between the years of 2013 and 2015. And of these 53 victims, 46 were women, which amounts to a roughly 87% rate of women being targeted because they were transgender. The rest of the victims were non-binary or identified as men. 39 or 74% were under the age of 35. And this is a very important figure to understand because of these 39 people that were murdered, their average age that they were murdered was 31, and this means compared to the average age of people in the United States at 78, their average life expectancy was 2.5 times less than the average life expectancy of a non-trans person in the United States. And the patterns found in these crimes are demonstrative of widespread violence against the transgender community every day within the United States, particularly transgender women of color, just because, as you can see in this graph, there are a large number of homicides specifically targeted against transgender individuals. Next, we have the mental and psychological violence against trans women of color. Roughly 23% of people experienced at least three major life-changing events. And these life-changing events include loss of employment or housing, denial of medical care, and physical or sexual assault, or incarceration due to gender identity. And African American transgender people experience much higher rates of poverty compared to the average American, with 34% of African American trans individuals reporting annual incomes of less than $10,000 a year. And this quote from the samhsa.gov, poverty may intensify the experience of medical illness. Poverty may also increase the likelihood of the onset of mental illness. This shows that African American transgender women especially are much more likely to have mental or physical atrophies because of their gender identity. And the National Transgender Discrimination Survey found that 63% of respondents had experienced an act of discrimination that had a major impact on their quality of life. And this, anything including a loss of job, eviction from their home, bullying, harassment, or assault. And while 23% of people experienced at least 3 major life-changing events, as I mentioned earlier. And adults aged 26 or older living below the poverty line were more likely to experience some of these mental harms, as I outlined before, with 7.5% of transgender individuals experiencing these harms compared to 3.1% of non-transgender people experiencing these harms.
And the next slide that we will be talking about is referencing the poor healthcare that transgender people of color experience. The University of Chicago did a study that empirically showed higher levels of negative healthcare experiences among transgender people of color. In this study, they interviewed 39 trans people, asking them to report their experiences with healthcare. The study showed how intersectionality compounded to cause transgender people of color to experience overall worse healthcare. One example of this that was outlined in the study had said, quote, a Black transgender man may be uncomfortable at a clinic that predominantly serves a white transgender population, but may also be uncomfortable in a clinic that mostly serves cisgendered Black patients. As a result, he might avoid treatment altogether, resulting in poorer health outcomes. I've also included a pie chart that shows some of the figures that were found by this study and the data that they were reviewing. Of the participants, 100% reported negative healthcare experiences, and 38% of those reported that healthcare experience or the healthcare professionals provided worse healthcare based on something having to do with either them being a person of color or a transgendered person as well. Something also important to note is that this study, while the results seem accurate or seem to accurately represent the transgender people of color population, it was also a limited study that only polled individuals from the rural Chicago area.
We propose a variety of solutions to address the issues faced by the transgender community of color. First, the U.S. should pass federal non-discrimination laws such as the Equality Act. The act was passed by the House of Reps in May of this year and is currently awaiting passage by the Senate. If enacted, it would amend current civil rights law to include gender identity as a federally protected class and would provide consistent and explicit non-discrimination protections for transgender people of color across key areas of life. Next, we should provide staff diversity training for addressing the needs of transgender people of color. Healthcare professionals must learn how to provide adequate and welcoming care for transgender individuals, and law enforcement officers must learn how to identify and respond to bias-motivated crimes based on race and gender identity. Furthermore, we must expand healthcare coverage for transgender people. This includes increasing access to transgender-specific hormone therapies, surgeries, and other medically necessary transition care. Additionally, we must expand access to housing and public accommodations to protect transgender people of color from discrimination when renting or buying a home, getting a mortgage, or seeking housing assistance. Finally, we must foster individual education and allyship. Cisgender individuals must call out transphobia when they see it and make space for transgender people of color to be seen and heard. Increasing representation of transgender people of color in the media and pop culture will also help to provide a more positive, diverse, and nuanced view of transgender people of color. And these are our 3 discussion questions. Thank you.